Thank you so much. All right. I appreciate it. Now I am back on, right?
Yes. Yeah, yes.
Okay. I apologize. Okay. So HIV patients, reviewing again, HIV patients with HIV positive, HIV negative, they are expected to live a similar long, healthy life. This is what this graph says. The second graph, and then the bottom two lines are meaning that HIV with the comorbidity, they have a much less life expectancy, but so is the normal people with the comorbidity. So in a way that if a person with HIV dies early, it's mostly due to the comorbidity. So is the same with the non-HIV patient or normal patients, let's put it this way. In conclusion, HIV patients, if he dies at this time, it is due to comorbidity. It is not due to like heart disease, diabetics, cancer, etc., etc. It's not because he's dying from the HIV itself. So I just want you to know about it. In conclusion, they live a very healthy life, even that they have to be on immunocompromised treatment all their life. So the reason I bring this up is because, number one, all the COVID specialty physicians are all HIV physicians. Anthony Fauci is a great example. And second, there was a big concern that HIV patients who are immunosuppressed, everyone is, for the last 20, 30 decades. So they are immunosuppressed, so, which means they are prone to infection. So people are expecting that, they are living with other people. They are not super wealthy who can afford a mansion of their own. So there has been a big concern that the COVID will take a huge hit on these patients, and then there will be double intake, there will be double uptick on their deaths and comorbidity, etc., related to COVID. So this study, just the Veterans Admin Cohort Study just studies that. It has a large sample size, 30,000 with HIV, and then 76,000 without HIV. And then the people who seek test for COVID is 4.8% versus 3.6%. Well, it is not surprising that HIV patients are extra careful about their own body, so they go and do more tests than the general population. So there is a statistical difference. However, in terms of the positive rate, it's 0.6 in HIV patients and 0.5 in non-HIV patients. They don't really reach statistical difference. So even that they seek test more, they don't necessarily get infected. Bear in mind that they are immunocompromised already. So they should, theoretically, according to medical school, but they are not. And then for those who tested positive and developed symptoms, their ICU admission, intubation, and their deaths have not reached significant difference compared to the general population. So in conclusion, contrary to people's belief, including the infectious disease specialty doctors' belief, there is no difference in the COVID infection or complication rates for HIV patients compared to general. So this study has a large sample, but there are many other studies who has much less sample, but they all reached the conclusion. And I am not going to go further. There's South Africa Western Cape study, which has large sample size. And then there is this other studies that all conclude similarly. So the big question is, why? Why did it happen? We were expecting a double intake in terms of virus. They are both both virus attack, meaning COVID and HIV, attack the host similarly by CD4, and they replicate similarly, and also the attack to the body. The symptom of the body is not only due to the virus, but also due to the host response. So the answer is, well, first, we don't know yet. We have to understand as time goes by. We understand HIV very well, but we don't understand the COVID yet as well. But second, there is this, there has been suspicion that the antiviral therapy in HIV, for example, remdesivir, which is one of the emergently authorized drug for COVID, protects both. And every single HIV patient, not without exception, has been on antivirus therapy, remdesivir or alike, for the past however many decades that they have. So this may play a fact that they already have been protected in terms of viral therapy. Even that their immune system is weak, they still do not get the disease. So this is what we do know, but let's see. More research needs to be done, and this is a very interesting topic as well. Okay, so moving on to